It really is a pleasure for me right now to host this panel because in my years as a journalist, I had the honor of meeting many wonderful, impactful personalities, and that includes my next guest, Dr. Brendan Gomez. Dr. Brendan is CEO and consulting psychologist for People Transformers. He's a United States Fulbright Scholar with a first-class honors in genetics, a master's in counseling psychology, and a PhD in applied developmental psychology. He is passionate about touching hearts and empowering lives, especially in increasing resilience and the well-being of people and organizations. And ever since MCO 1.0, he's been very vocal about trying to reach out to people suffering from mental health issues as a result of this pandemic. So it's really a great pleasure to have Dr. Brendan joining us online today. Welcome, Dr. Brendan.
We're talking about the rising challenges of mental health caused by COVID-19 and how NGOs can help. And first, let me say I'm honored to be among highly respected people here. Shani and Naz are people that I know continue to do good work. During Japan's tsunami in 2011, Shani was instrumental in helping us launch blankets for Japan. And we were able to airlift 2 tons of blankets to tsunami survivors, children and families in Sendai. So let me set the record straight. We can wave the white flag, but we won't surrender. There's more that we can do. And maybe this can be our mantra for the next 15 minutes, and everyone can join me. Why don't you join me? Yeah, all of you who are here, join me in this mantra. We can wave the white flag, but we won't surrender.
We can wave the white flag, but we won't surrender.
There's more that we can do.
That's powerful. There's more that we can do.
That's right. So that's going to be our mantra for the next couple of minutes, for the next 15 minutes, as I talk about mental health. It's a huge issue. As psychologists, we have seen a great increase in people struggling in 3 areas of mental health, and you might see it on the slide. The cognitive emotional aspect, feeling overwhelmed, for example, work-life balance, feeling trapped. The MCO, the EMCO, imprisoned by stuff that is going on by the SOPs, isolated from family and friends. The second, the financial despondency, salary cut, loss of business, loss of job. And the third, the loss of future, the loss of opportunities for growth and development. And by the way, in relation to the number 2, the financial despondency. Did you know that 4 in 10 households in Malaysia don't even have the finances to get face masks for their children? That's how bad it is. So I'm trying to address developing safer and cheaper face masks on the side for children because I believe safer face masks are the best way we're going to have to arrest the spread of COVID since it's airborne. And to prevent further MCOs that close schools and businesses and destroys our economy. So if you believe that you can provide a solution, please go to the website. The link is on the slide here. And if you'd like to help, please let me know that if you can help. So why do these 3, cognitive, emotional, financial despondency, and loss of future, impact our well-being? Now, to answer this pertinent question, we have to look at what makes us human. What makes you and me human? What makes us human? Our sense of purpose and direction, our sense of productivity, our sense of companionship, and sense of joy and enjoyment. These are 4 things. These are 4 critical things that makes us human. And it's, as psychologists, we talk about the Maslow's hierarchy of needs. So do you want to do a quick assessment for yourself, where you are right now?
You mean me, Dr. Brendan?
Oh, everyone who's watching, everyone who's listening in. Now, you see over here, it depends on where the screen is. Over here, there's a QR code. You can use your phone, scan the QR code. It's going to take you to a quick assessment of your well-being or your human well-beingness. Okay? It's a very quick assessment.
Doing it now, Dr. Brendan.
Sorry?
We're doing it now.
Excellent. Now here you can rate your purpose and direction, productivity in your current life, companionship, and joy and enjoyment. Okay, I'll give you just, I'll just pause for like 20 seconds just so that you can snap a shot and just look at the Google form. Now, it's not a formal or empirical based assessment, yeah, but it'll give you a rough idea of how you are feeling, and the risks to look out for. If you have 2 or more of these scoring below a 3, it is something that I would be concerned about. Due to the pandemic, for many people, all of these areas that makes us human have been impacted. The virus has destroyed what we knew as the essence of human life. These then are the risk factors that give rise to other risk factors that feed the breakdown of our mental health. Because what happens when we lose our sense of productivity? We feel, what do we feel when we lose our sense of productivity?
Yeah. Useless and helpless.
Exactly. You feel useless. And what happens when you feel useless?
Like there's no reason for living.
Exactly. You feel paralyzed in life. And what happens when you feel paralyzed in life? What do we start doing or not doing? These are questions that we need to ask ourselves. So take another one, sense of companionship. What happens when we lose our sense of companionship? We feel
alone.
Yes, we feel lonely. What happens when we feel lonely?
Powerless, not able to get help.
That's right.
Yeah.
We feel unloved, we feel uncared for. And what happens when we feel unloved?
Again, no purpose for living.
Yeah. So then
there are some comments coming in from people as well. Unwanted, hopeless, basically. It's
And what happens when we lose our sense of joy and enjoyment? We feel what?
Despair.
Exactly. We feel yuck. We lose our energy. Then what happens when we lose our energy?
We just feel like we can't go on and do anything else, demotivated.
Exactly. We feel demotivated, hard to get started. And what happens when we lose our sense of purpose? What do we feel?
No point going on.
Exactly. We feel lost. What's the point of going on? So it's easy to lose our way, easy to fall into unhealthy behaviors, alcohol, drugs, smoking. These are the concerns that we have as mental health professionals right now. We're not talking about short-term things. We are talking about long-term effects in terms of mental health. And that's really what we're concerned about. So we see our mental health is so connected to who we are as human beings. Mental health does not exist separately from human life. It's not a taboo to talk about mental health. To separate mental health from everyday human life is to cut off your fingers and say it's not part of your hands. We lose touch with reality. Literally, we lose touch with reality. So the thing is, right now, when we look at the COVID pandemic in our nation, in terms of the mental health, how bad is it? Anybody want to take a stab at this? 5 possible scenarios. How bad is the mental health situation in our country right now?
We have one comment here saying extremely bad. Yeah.
So it's bad to pretty bad, very bad.
Yeah, so the responses we're getting are, between bad and extremely bad.
Yeah. So from January 1st this year to June 18 this year, the psychosocial support helpline received a total of 122,000 overcalls. Imagine that in just the first half of this year. Some years ago, we already projected that by 2020, mental health will be the second biggest health problem in Malaysia after heart disease, after heart disease. This was before we even experienced COVID. Already in 2019, we were seeing 500,000 Malaysians showing symptoms of depression. And this is from MOH, MOH, So I'm not plucking this out of thin air. So the is an average. If you look at recent news reports, there's an average of 4 recorded suicides a day in Malaysia from the start of 2021. 4. And that's recorded. For every recorded case, according to some NGOs, there goes 10 that goes unrecorded. So impactful was this that it made news across Asia and covered by CAN. Yeah, so there's a link here if you'd like to check it out on CAN. Please go ahead. The main and by the way, some of these links which I talk about are also in at the end of the assessment that I had given you. Yeah, so you can also look there. The main cause of increased suicide in the nation is family stress, emotional stress, financial stress. Where is all this coming from? Pandemic stress. Pandemic stress. Our COVID pandemic stress. So in the impact of this pandemic on mental health is seen in every strata of our society. In employees, a recent survey of Malaysian employees showed 71% worried about financial well-being. 66% are worried about their physical health, and 62% are worried about their mental health. And it's all interrelated, really. Now, work from home was once seen as ideal, but now many are struggling with WFH, and now finding it WTF. For many, it has blurred the lines between work life and personal life, and finding the switch off button can be difficult. In fact, already our Malaysian workforce was reporting significant mental health issues way before the pandemic. In 2019, a survey by AIA found that half the workforce polled in Malaysia are stressed out. About 1 in 10 Malaysian employees are either anxious or depressed, with most of them being in the younger age group. So you see on this, you see some of this on the slide here. Now that's just in terms of the adults. Yeah. What about the children? What's happening to our kids? What's happening to our children in this country? It's even more disturbing. 51% of suicide cases recently are teenagers from 15 to 18 years of age. Let me just let that sink in. Yeah, already way back in 2017, we were seeing the mental health of teens in our country deteriorate according to MOH. Yeah, 1 in 5 were depressed, 2 in 5 anxious, 1 in 10 stressed. But today, even among younger children, the pandemic has impacted their mental health. And we don't even have that statistics yet in terms of the younger children. Our families, why is it worse? Why are our children impacted by the pandemic in a big way mentally? A big part of this is because of connections.
Yes, my kids are really missing their friends.
Exactly, Shani. Social connections are critical, especially for children and teens. A big part of their social connections happens in schools. But if schools are closed, how do these happen? Is this being facilitated on their online classes? Is it? How?
I think they miss the opportunity for physical play as well. That physical connection is missing.
That's right. And another reason is the home has become more stressful an environment. Parents are either working from home or have lost their jobs. We just heard that from so many in this forum. Stress and tensions in the family have risen. There are thousands living in small apartments or houses with many family members locked up, caged up, fenced up due to the pandemic. What does it do to one's state of mind, to one's home interactions? Children and families' mental health is a key concern for me. So if I'm getting a bit too passionate about it, it's because I am. So recently I worked on a mini book with various families to share as a resource. And Shani and Naz are one of the wonderful families among the many who shared a wealth of information in this book. It's available free on my website, arcade.org, arccade.org, or you can go to the link that you see here. Again, that link is provided at the that survey assessment right below there. The links are also there so that you can follow along. So it's a free book and a free resource for you. So I started off by saying the virus has destroyed what we know as the essence of human life, our sense of purpose and direction, our sense of productivity, our sense of companionship, and sense of joy and enjoyment. The question we have to ask ourselves, even I have to ask myself every day, has it? Has COVID really taken these away from us? Our sense of purpose and direction, our sense of productivity, our sense of companionship, our sense of joy and enjoyment. Have these really been eliminated altogether? Or has it changed? Has it changed? Has it evolved? So while the pandemic has changed the opportunities for us, has changed the landscape around us, it has not really taken away our sense and desire for a purpose in life, for wanting to be productive, the need for companionship, wanting joy and relaxation. So while the virus has robbed us of many current opportunities, it has not robbed us of what's inside of us. It has not robbed us for what is inside of us. Again, let's say this together. We can wave the white flag.
We can wave the white flag,
but we won't surrender. There's more that we can do. So I have four tools that you can use to protect the mental health in your communities and organizations. 1, well-being pods. 2, positive psychology supporters. 3, action mobilizers. And 4, quality time with loved ones. Now, I've shared this link again on the assessment right below. There's a link there. You can click on it. It was something that I shared with the Star recently, Star newspapers recently. So the question is, how can NGOs and even corporate organizations, many of you are leaders in corporate organizations, how can even NGOs and corporate organizations help? An even more important question, what can NGOs and other organizations do that will bear results? Because we can do many things, but do they bear results? Or is it shock sendiri, only for our own edification? We get to tick the box, put our photo on Facebook, get 500 people praising us. As for the actual effects on the nation's mental health, So we need efforts that are effective and sustainable. How can we ensure our efforts are effective and sustainable? We must always address the root cause. The root cause. NGOs like Kiwanis can plan long-term projects for mental health that address any or all 4 key roots causes of the pandemic. The psychological distress in their communities, the sense of purpose and direction, the sense of productivity, the sense of companionship, the sense of joy and enjoyment. Okay, you want an example of this? Here's an example of this. Yeah. Here's one way of visually representing your efforts to be clear on what you are targeting. And this is just an example. Yeah. You can, here's a list of possible projects on the slide, a list of possible projects that one can do. Anyone, either NGOs or organizations, career and entrepreneurship counseling and support, family support and parenting programs, kids wellness circles, weekly online social support groups facilitated by para counselors, online community fun camps, interactive wellness toolkits, educational and skill building workshops on well-being. There's so much that you can do. But more importantly, it's not just about doing, but about mapping it on the risk factors for mental health. The sense of purpose, sense of productivity, sense of companionship, the sense of joy and enjoyment. How much would it rate in terms of your efforts? And the scores can be from 1 to 5. You can then check these scores. Against participant feedback to determine if you have met your goals, your targets, your ROI. Because that's important. You want to know whether you are reaching the right people and the right target. So I've listed some practical examples of what NGOs, even corporate organizations, can do to help in mental health. Now, you have to now ask the question, why would this be helpful for mental health during the pandemic? Why would these be helpful? Career and entrepreneurship counseling, family support, kid wellness, weekly online social support. Why will all this be helpful? You have to ask yourself, based on your communities. So as an organization, ask yourself, what are the needs in my community? 2, what is my capacity to help? 3, how effective are my efforts going to be? And 4, how do I sustain these efforts for the long run? For the long run, how do I sustain these efforts for the long run? So if you need help in determining what are the human development risk and protective factors in your community to target, or in developing intervention programs for mental health, or in evaluating effectiveness of your efforts, do they map onto your target areas? Feel free to reach out to me. I'll see what I can do. In addition to my private practice, I also run a non-profit called Arcade, ARCCADE, the Asian Research Center for Child and Adolescent Development. The primary focus right now is developing safer masks for school children. So if you'd like to help out for 3D designing or prototyping, feel free to go to my website. Again, the links to the various resources I talked about, look at the QR code. Feel free to scan it, because those are the ones that have all the links available right below. Finally, I want to give a shout out to My Burger King. My Burger Lab, my apologies, My Burger Lab, for how they advanced mental health of their employees recently. I don't know whether you read it, what they did recently. Yeah, they gave their workers, employees, all the employees, 5 days off. You know, one of the founders is a grad from Nottingham, and having taught at University of Nottingham, I just want to say how proud I am of such people in businesses that are creating real solutions for mental health during this pandemic. And by the way, I don't get anything from My Burger Lab or Nottingham. This is not free publicity for them, but I really like what the guy said. It's not that we can afford to close, it's that we can't afford to lose our people. So let me end my session with this, with our mantra, and please join me. We can wave the white flag,
but
we won't surrender. There's more
that we can do. And I think maybe this is your clarion call, I think, for everyone tuning in, that if we continue to repeat this to ourselves, it can hopefully provide us hope when we feel there is none, right, Dr. Brendan?
Exactly. Yeah, and it's a very behavioral approach, cognitive behavioral approach. That's something that I take. We need to realize that we the white flag is known as surrender, but in Malaysia, this flag is known as strength. It should be seen as a symbol of strength.
Exactly. I think by viewing it as a white flag, as a sign of surrender, that is simply just going to make the situation more despairing for a lot of people. So if we view that instead, just flip the script and look at it as a sign of hope and a sign of strength, then we can also change the way we think about it. There are lots of questions coming in from the people watching, Dr. Brendan. One in particular was really about the effect of social media on mental health during the pandemic. Obviously, social media now is the only way we can actually still communicate and socialize with our loved ones and our friends. But at the same time, the question was, is it also fueling the increase in mental health issues among people right now?
A great question. Even before, social media was seen, psychologists were very worried about how social media was seen, because honestly, for example, for Facebook, you see many of your friends posting happy faces, happy events, and they're all looking happy. And here you are sitting at home, trapped in your house, feeling depressed, and you see all these happy faces. How do you feel?
Exactly. It can give a very unrealistic idea of what everyone's going through right now.
Exactly. So already way before the pandemic, people were worried about the effects of social media. for their psychosocial well-being, particularly for those who are already vulnerable to mental health issues. At the same time, we need to view social media as both important and yet with a pinch of salt. We need to be able to be smart enough, or at least educated enough, to know that, well, Facebook is just what it is. It's you'd have to take it at face value. You know, a lot of people post happy photos, but that does not mean that they're happy. Yeah, it's just a portrayal. Dig deeper, and most everyone are struggling. Most everyone are struggling. You know, they're not going to tell you this. You know, I mean, who's going to tell you? Yeah, who's going to post photos of their depressed faces on Facebook? No, nobody does. Most people don't. Yeah, because it's not what people do. The second part of it is in terms of all the different news that comes up through your WhatsApp chats. You know, and oftentimes people are sending political stuff and depressing stuff, and so you have to know how to weed through these and realize that, yeah, there's some truth in some of it, but there's not, some of it is just news that is meant to, it's just meant to incite rather than be constructive. So we need to look at what's going to be constructive, what's going to help. At the end of the day, we have to make the decision how to use social media for our good. Now, I can't say I'm perfect in doing that, because I've also made mistakes with social media. Sometimes I buy too much into it, and I too feel a little bit down, and so today, or at least in the last couple of days, I've been thinking, what's a great idea would be to actually have for myself at least 1 day or 2 days a week where I'm posting things that are more constructive, that are more constructive, and I think that's going to help. I'm not too sure whether it's going to help others, but it's going to help me, because then I am going to change the way I look at things. Not to say that I'm totally blind to what's happening out there. I know what's happening out there. I'm acknowledging it, but at the same time, I also want to see some positive stuff, so that I know that life is more than just the virus.
That's true. You've given me a lot to think about, Dr. Brendan. We just have a couple of minutes for me to direct questions to you before we open up the Q&A for the entire panel of speakers we've had earlier. But can we just very quickly summarize? I'm going to summarize the questions that we're receiving into one question here, which is basically the white flag that people put up when they need help. I mean, they're basically putting up the white flag because they do not know where else to get help. Now, right now, they're putting up the white flag for necessities, groceries, that kind of assistance. But there is really no way for people to put up a white flag for mental health. One commenter rightly put it that there are some people in Taman Sentosa, the B40 group, are in such a despairing state that they probably need mental health assistance as much as they need groceries. So really, that's something for NGOs to look into. How can people get mental health assistance with the White Flag campaign?
Yeah, I think, well, there's two parts to your question. One is, how can people get mental health support in this current situation? Two, I think your second part of the question is, how can people get mental health support through the White Flag campaign? The second part of the question really relies on NGOs and community groups to be able to recognize that it is a great need in their communities to address the mental health. It is so great that we cannot at any point sweep it under the carpet any longer. Everybody, every strata of society, especially the lower income, the middle income, everyone is going through this, and they need support. And I've given examples of what people can do to help support this, to help these are on this slide, many of these are projects that can address mental health that NGOs can do, and it doesn't have to be elaborate projects. Yeah, it doesn't have to be elaborate. You just have to use your imagination. It can be very low cost in terms of projects. What's most important is having groups of people with caring hearts, even though they're going through struggles themselves, being able to say, hey, you know, I'd like to be there for you because I know how it is. You know, let us be together so that we can try and support each other through this. And it's like a shipwreck. If everybody gets thrown in the water and you stay as an individual, it's easier to sink. But if you hold hands in the waves, in the water, in the sea, in the choppy seas, if everyone is holding hands in a ring, it's easier to stay afloat. It's easier to stay afloat when we are together. And that's really what NGOs can do.